During the final days of a terminally ill loved one's life, an alternative to short-term hospitalization is in-home hospice care. But according to the National Hospice and Palliative Care Organization, less than 10% of African-American families are utilizing this support. The Visiting Nurse Service of New York's Project Hope program in Harlem is designed to overcome barriers and connect families with emotional and even spiritual support. Here today is Michelle Drayton, Director of Community Outreach, and Faith-Based Leader, Reverend Joanne Owings. Thank you both for being here this afternoon.
Great to be with you.
So let's just start by, if you could, briefly explaining what hospice care is.
Absolutely. Hospice is a team-oriented approach to provide comprehensive medical care, specifically comfort and pain management to patients with advanced illness. And hospice normally occurs in the home. The patient and the family actually receive a team, a doctor, a nurse, a social worker, spiritual care counseling, all coming into the home to really tailor care at the end of life to ensure that the patient is comfortable, as well as their pain being managed during terminal illness.
What have you found to be the major reason that African Americans are less likely to take advantage of this kind of care? What is the misconception that prevents that?
Well, there are really significant myths. We found through the HOPE program, which is a hospice outreach patient and provider engagement initiative. And I will tell you, we discovered many things. One is that it's not just patients that have misperceptions about what hospice is and when it's appropriate, but also providers themselves. So there are myths and misconceptions about what hospice is, when it's appropriate.
There seems to be one of the major ones, and I've heard this from relatives, I'm sorry for interrupting you, is that somehow once you say we're going to get hospice care, that just means you're hastening the person's death.
Absolutely. People think that, you know, I have to be passing in a day to be appropriate for hospice. To be appropriate for hospice, you need a prognosis of 6 months to a year, and people don't know that hospice actually prolongs life. This is statistically proven.
Because the care is focused on what that person needs, and it's professional care.
Absolutely. It's people coming to your home. You're no longer in a hospital environment. It's targeted to your symptoms. We manage symptoms, we manage pain, and you have this incredible team of professionals coming into the home to support not only the patient but the entire family, so that the family is engaged. A lot of times people think that hospice, you have to go to a place.
Yeah.
So, you know, immediately when I'm at a hospital and I'm evaluating a patient and I'm talking to their family, they say to me, Sandra, I don't want to go to that place.
Yeah,
and I said,
no,
you know, hospice isn't a place. We come to your home. And so really, I think that unfortunately the messaging around hospice has been done in a way that does not really fully tell the story that hospice prolongs life. It's about comfort care. And the Visiting Nurse Service of New York, we've been providing this service for over 30 years now.
I want to bring you into this conversation, Reverend Owings.
Yes.
Do you, if you have the conversation with families, you're able to get people to open up, well, I guess, open their minds to the thought? And are some of the concerns that somehow as I said before, that you're hastening the death, and so somehow that's against whatever the religious beliefs of that family happen to be? Because I know spirituality becomes involved in sort of the myths surrounding hospice care.
Yeah, I believe all of us are spiritual. We may not be religious, but spiritual, having a connection to a higher power or a force that centers us. And so when a person has been given a diagnosis and is in hospice, the spiritual care counselor journeys with that individual and family. But many times persons think that if I talk about death or if I even entertain it, then I'm hastening it.
You're giving it too much power.
Exactly. Yeah. Or if I decide to go on hospice and not go through the various protocols that may have been suggested, then I am not allowing God to do what God does. And certainly God is going to do what God does, whether we decide or not. But certainly if you have an individual, a person like myself, a spiritual care counselor, to make the journey with you, to talk with you, to listen to you, and to allow you to cry and to grieve and all of those things, then the journey might be a little